thanks everyone for joining this presentation on some work that I've conducted concerned with how E. coli can be a sort of a climate threat in that it can be waterborne and there's greater risk of climate events and flooding and this sort of thing. So we're very much concerned about this as an emerging issue. And what we've looked at is some data on older people's utilisation of healthcare in Ireland, where we have presentations of E. coli in their water supply. All right, so by means of introduction, exposure to waterborne pathogens in drinking water can lead to serious illness and a need for the use of healthcare services. And gastrointestinal illnesses, very unpleasant, are a particular burden for the elderly, for whom hospitalization and fertility rates can be disproportionately high in this group. So GI can include diarrheal disease, needless to say, and it's been linked to E. coli detected in drinking water. And the aim of our study is to investigate the association between the detection of E. coli in drinking water supplies in Ireland and the use of healthcare services by our older population. And the motivation for this research was really the absence of evidence on the association between pollution limit exceedances in drinking water tests. We're certainly familiar with the likes of boil water notices and things like that, but there hasn't been a great deal of research in Ireland done on how this impacts healthcare services. And needless to say, having that sort of information will hopefully assist us in making decisions on resources, policy making across a number of areas. So environmental related decision making, healthcare management, and indeed infrastructure planning. And we're talking about water supplies and such like that. And then today's conference is very much about climate change. So we've got that risk coming up, needless to say, and increasing, as well as the aging of our population in developed countries. So these two forces might combine and lead to a potential increase in morbidity and mortality linked to waterborne diseases, to which older people are particularly vulnerable. So just very quickly, I'm afraid I don't have a terrible amount of time, but in terms of the policy around this area to date, drinking water guidelines are issued by the World Health Organization, and the elderly are identified as a vulnerable subpopulation at risk of disease. And then within the member states of the European Union, of which Ireland is one, the drinking water directives, and they're updated fairly recently, lay down the legislation for ensuring that drinking water is safe. And there's all these different parameters, arsenic, all sorts of lead content, these sort of things that, that our water must legally, be of good quality for. So of one of those parameters is E. coli, and E. coli itself would, in our water, would indicate that there's fecal pollution, so runoff typically from fields and manure and such like that. And this, where we see E. coli present in the water, it would be an indicator of the potential for waterborne disease. So in terms of public water supplies, the frequency of water quality failures are fairly low, but the impact of a single failure can be dramatic. And there's lots of various pieces of evidence from the likes of Finland that document, hospitalizations and stuff like that from pollutant water incidents. In terms of the background as well, there is a greater risk from waterborne pathogens due to population growth and greater urbanization, interaction of farming practices with rainfall and climate change, as we mentioned, a greater number of immunocompromised individuals. And then these strains of microorganisms themselves are evolving, and there's drug resistance as well. So that's on the more pharmacological and medical side. In terms of what occurs among patients where they are infected, of course, we know from COVID plenty about asymptomatic cases, but in cases of symptomatic cases of GI, abdominal cramps and pain, diarrhea, some cases vomiting, and this can progress to bloody diarrhea. But for some groups, the very young and the very old, there can be greater complications where red blood cells are destroyed, and there's a condition of the kidneys, hemolytic uremic syndrome, which can cause renal failure. So some of the outbreaks among the elderly have been found to be particularly dangerous. And then in terms of climate change in Ireland, we know that there's, well, forecast greater incidence and severity of extreme weather events, and this can trigger the contamination of public and private water supplies, and from that there's a greater risk of human waterborne infections. And just some of the academic literature has already ranked Ireland as second most affected country in terms of the national population that are most likely to reside in flood-prone areas by 2100. And within that, then there's susceptibility to flood-associated health impacts. And for every 1 degree Celsius increase in medium in average temperatures, there is estimated to be an increase of 8% of E. coli, diarrhea-related E. coli. So in terms of our study, given that background, we did a data linkage exercise where this was the dates, the years of this data that we're looking at was really determined or hinged by the maps of water systems that we had. So prior to 2013, in Ireland, water systems were looked after by the local authorities. Now, in 2013, then there was a new act, the Water Services Act, and that became what we know today to be Irish Water. So that's more like a semi-state, well, private company to some degree. So we don't have those maps anymore, but we do have the current maps, but we do have the old maps that were local authority maps. So the latest one we could get was 2009. And I suppose the water infrastructure doesn't dramatically change over that time. So it's still relevant. So that was the basis. And then with that, we linked the water monitoring data, which is done by the Environmental Protection Agency. So we took the year 2010 for that, and that's public data available on their Safer archive online. And we matched that to our information on older people's use of healthcare services from TILDA, which many of you might be familiar with. And the first wave of TILDA occurred over the period 2009-10. So it's not exact, but it's as close as we could get in terms of the lineup of all those data sources. And I've sort of mentioned those. So what we do is we create from the EPA drinking water monitoring data, we create a variable where the water scheme has E. coli detected in the water in 2010, and that's our exposure of interest. Now, as I say, the EPA data is only for it's only for public wells that are monitored. In Ireland, we still have quite a few private wells that aren't monitored, particularly in rural areas, and these are exempt from the this legislation, the European Drinking Water Directive. So we don't have data in our study for those, and those wells are the ones that are most problematic, I'm afraid, in terms of effluent runoff and stuff like that. So we just, where we don't have them mapped, we include a dummy in our models and sort of account for the confounding from them. But we'd love to do future studies more in detail of those. So I mentioned TILDA gives us microdata on healthcare utilisation and socioeconomic conditions. So in wave one, there was about 8,000 people first interviewed, those over 50 years and living in the Republic of Ireland. And not only do we know about their healthcare utilisation, we have lots of information on their socioeconomic situation and health, that we can control for other factors that might influence the relationships we're examining. And then I'd mentioned about the water systems data comes from 2009 from the local authority information. So we're linking all of these things based on the tilde respondents, or older people's residence. So we know where they live in the country, and we map on then the water system that they are likely to be associated with, and then we know what the exceedance of E. coli is in that water system. So this is just an illustration. We have sort of the polygons there, and would indicate the water systems. The red dots are the residences, and as an example, we have in the darker grey a water system that's had E. coli detected on it, and that's the sort of ones we're interested in, and comparing them with everyone else. So in terms of our tilde outcomes, we have recorded the number of visits to the GP in the last 12 months, the number of visits to hospital emergency department, and nights spent in hospital. And we treat those like the number of, but we also we treat them whether or not, a dummy variable, whether or not they made these attendances. Our
Okay, Greta, you're on the last sort of 1.5 minutes.
Okay. Let's Rock is our E. coli variable, and we make various controls. So what we see is in the end, in the dark black there, where you have an E. coli detected in the water, there's a higher number of GP visits, ED visits, and hospital nights compared to where it's not detected in the water. The regression results confirm this. So a 1.1 higher odds of visiting a GP, a 1.3 higher odds of having an emergency department visit, and a 1.3 higher likelihood of having a hospital night where you have E. coli detected in the water. So what we've seen in our data is that E. coli is detected in the water for a very small proportion of our tilde respondents, only 4%. But where it is detected, we're finding a higher demand for GPs and hospitals. And this concurs with a lot of the other literature. So we're seeing that this might very well merit greater intervention and action on the part of our various organizations across the farming community, water officials, and public health professionals going forward, given that there's a significant threat from climate change. And one, in terms of the policy recommendations, is we might need greater sort of satellite surveillance data for weather and climate forecasting, so that we can sort of predict when healthcare utilization might be especially higher. So say we have a very high rainfall it'll give a couple of days, and then we might expect to see people's water related problems, a lag time in that. So that slide is a summary of our results as an infographic, and I'm very happy to finish there and take any questions.